Okay. So first thing I'm going to do is I'm going to come in, wash my hands, and pull the curtain for privacy. Introduce myself. My name is Jaleesa. I'm going to be your nurse today, and I observe a 49-year-old female with no acute distress, no well nourished and well developed. Can you tell me what your name is
Valisa Ford,
and your birthday?
12571.
Do you know what today's date is?
August the 9th, 2020.
Who's the president?
Trump,
And what are you here for?
a physical.
Okay. So the patient is alert and oriented times
I'm in
4.
the doctor's office.
Okay. The patient is alert and oriented times 4, and she has clear speech and is coherent. The next thing I'm going to do is I'm just going to assess your muscle function. So I'm going to place my hand near your face, and I want you to use resistance against me every single time. Just for your face. And I'm going to do the same for your shoulders. Press again. Okay. Next thing, I want you to put your arms like this, and I want you to use resistance. Okay. Squeeze my fingers. Okay. I'm going to do the same for your legs. Press against my hands. And then the same for the feet. Okay. There we go. So the patient has a strength of 3 on a 1 to 5 scale. The strength is equal and bilateral in the upper and the lower extremities. The next thing I'm going to do is I'm going to assess your sensory motor neurons. And, okay, so we're going to check your sensory neurons, and I'm going to touch you with this if you feel something soft. And then I'm going to use this one for something sharp. And I'm going to test your upper and your lower extremities. Let me know where you feel it and what it feels like. And I need you to close your eyes for me.
Soft, right, upper arm. Hard, left, lower arm. Soft, left, upper arm. Hard, left, right, right, lower arm. Hard, right, lower leg. Soft, right, lower leg.
And this one again?
Hard, right, upper leg.
Okay.
Soft, left, upper leg. Hard, left, lower leg.
Okay. So the patient's sensory neurons are intact in the upper and the lower extremities. Next thing I'm going to do is I'm going to check for reflexes. And I don't have a hammer, so I'm going to use my pen light as a guide for where I will be hitting those areas. So next I'm going to, right here on the brachial, and tap against my hand and see the reflex. Next I'm going to do the radial area. Next, I'm going to do right below the patellar bone. Can you uncross your legs for me? I'm going to do the back of the knee area. And then I'm going to do, I need to put your foot up. Sorry. The Bushinski by going in a U shape and the toes to curl. Okay. Okay. So, all of the patient DTRs and the Bushinski are intact and normal. Next thing I'm going to do is I'm going to have you stand up for me and take 5 steps, normal steps that way. Okay. Can you turn around and take 5 steps on your tippy toes? And turn around for me and take 5 more steps on your heels. And then last 5, heel to toe in line. Okay, you can sit down for me. So the patient has a normal station, and the patient also has a normal and tandem gait. Next thing I'm going to do is begin the head to toe assessment. Is it okay if I touch her head?
Yes.
Okay. So I'm feeling for any tenderness and any palpation, any tenderness and any masses. and I don't feel any of those, any tenderness or masses on palpation. I'm going to check for perla. Can I have you just look straight at me? Okay. Okay. And then I'm going to check for accommodation. Have you look right here for me? Okay. So the patient's pupils are equal, round, and react up to light, and the patient also has accommodation. Also don't see any visible drainage or any redness or signs of infection. I'm going to look at the nose for any nasal flaring, which I do not see. I'm going to look just inside. I'm going to look at the mouth. I don't see any circumoral cyanosis or any pursed lip breathing. Can you open for me? I'm looking at the mucous membranes in the tongue, and they are pink and brown for ethnicity and moist. No dryness. Okay. So I don't see any signs and symptoms of respiratory distress. Next thing I'm going to do is I'm going to look at the neck. I'm looking for any jugular vein distension, which I do not see on observation. And I'm going to feel the carotid pulses one at a time, checking for the thrill and the pulse. So the patient has a carotid thrill. Next, I'm going to check for any bruits. And I'm going to have you hold your breath as I do this. So hold your breath for me. Take a breath. Hold your breath. The patient does not have any bruits on the auscultation of the carotid arteries. Next thing I'm going to do is just look at the chest area. I'm looking for any retractions, any heaves, any tripoding, any barrel chest, any signs and symptoms of respiratory distress, which I do not see at this time. Next, I'm going to palpate the thoracic area. I'm going to do the same in the back in 6 areas. No tenderness or masses felt upon palpation. And next I'm going to auscultate the lung field. Take a deep breath in and out for me. Okay, I'm going to do 8 locations along the back. Okay, lift your arm for me. I'm going to do 3 on this side. And I'm going to do 3 more over here. So the patient's AP lung sounds are clear bilaterally. No signs of wheezing, crackles, or bronchi. Next thing I'm going to do is I'm going to just assess for any heaves at the valves of the heart. We're going to look at the pulmonic, aortic, earth point, tricuspid, the mitral valve, which is located at the 5th intercostal space mid clavicular line down. Okay, and I don't see those, so I'm going to also palpate those areas. And then so no he's felt or no Okay, so next I'm going to auscultate for heart sounds at the valves. The patient has a normal sinus rhythm, S1 and S2. There is no observation of any S3, S4 gallops or murmurs. Next thing I'm going to do is check for capillary refills. Can you put your hands like this for me? So the patient has a brisk capillary refill with less 2 seconds, which is normal. Next thing I'm going to do is I'm going to assess the pulses. Now we're going to do the brachial. Okay, we're going to do the radial. But you can do that strong. We will do the femoral, which is located here. We're going to do the popliteal, which is back behind the knee. I'm going to do the post-tibial. And then lastly, I would do the pedal pulses, which is right on top of the foot. All of the pulses are a normal, regular rhythm. +2, which is normal, upper and lower bilaterally. One moment, please. Oh. And then also the heart rhythm was a normal, regular rhythm as well. Last thing I'm going to do is, I'm also going to test for edema in the upper and lower extremities, and I'm going to feel for warmth at the same time. So, test for edema in the upper extremities, test for warmth in the upper extremities. I'm going to test for edema in the lower extremities, and then I'm also testing for warmth in the lower extremities. And no edema was observed in the upper and lower extremities, and warmth was felt in the upper and lower extremities. Last thing I'm going to do is I'm going to assess the abdominal area of the patient. Oh. So I'm looking at the abdominal area for color, which is normal for ethnicity. I do see that there are some stretch marks on the abdominal area. I don't see any surface motion. I don't see any venous pattern changes. I don't see any venous pattern changes, any surface motion, any of those things. No surface motion or anything. So next thing I'm going to do is I'm going to auscultate the abdominal area in all 4 quadrants. And usually you will listen to this area for up to 3 minutes to make sure that you hear normal vowel sounds. So the patient has normal active bowel sounds present in all 4 quadrants. And next thing I'm going to do is listen for any bruits in the aortic, renal area, and the iliac crest. So no bruise were heard in the abdominal area. And the next thing I'm going to do is I'm going to lightly palpate, starting at the right upper quadrant and working my way around. So no masses and no tenderness was felt upon palpitation. Next thing I'm going to do is I am going to percuss the abdominal area. So normal intonation was heard when percussing over the abdominal area, and I would like to mention that when you do listen to a patient who is slightly obese, as this patient is, sometimes with more obese clients, then you would lay them down on their left lateral side to listen to their heart sounds, and that would end this health assessment.